The resurgence of vaccine-preventive diseases have made these long queues on health centers in the metro. Parents like Marielle, a mom of two, told News 5 that she never lost faith in vaccines despite the Dengvaxia scare.
Pag hindi mo din po siya na-inject ng ibang inject dito po sa center, paano na lang po pag nagkasakit? Di mas malala. Wala siyang protection sa ibang sakit.
Health workers are happy to see the spike in number of parents getting their kids vaccinated.
Ay nakakatuwa po sila kasi sila na po talaga na pumupunta.
The DOH has a mandatory basic immunization program since 2011, requiring all children to be vaccinated from 0 to 5 years old. The vaccines including polio, tetanus, H influenza, and anti-diphtheria are free in public hospitals and health centers nationwide.
As early as upon birth, we give hepatitis B and BCG, and this practice is being done in both public and private hospitals. After which, at the 6 weeks of life, we start giving the 5-in-1 and the oral polio. This is what is being offered at the health center now.
Despite these efforts, another polio case is suspected in Cotabato. An infant has fever and one of her legs paralyzed. Meanwhile, the earlier case of polio in Lanao has worsened.
Sa history ng bata, wala siyang bakuna, so walang protection yung katawan niya.
This morning, the Department of Health confirmed that a 10-year-old girl in Manila died due to diphtheria. The Palace's Health Secretary Francisco Duque assured them that no diphtheria outbreak will be happening soon, as everything is under control.
Ako naniniwala ako na ginagawa niya ang lahat niyang makakaya upang pangalagaan ang kalusugan ng sambayan ng Pilipino.
For News 5, Laila Pangilinan, we are One News.
Polio, measles, and diphtheria are diseases that were supposedly eradicated or under control in the Philippines, but they are now making a resurgence in 2019. Just this month, 2 cases of vaccine-derived polio have been confirmed, one in Lingao province and another in Laguna. Now a third case is suspected in Cotabato City. It was back in the year 2000 when the World Health Organization declared the Philippines as polio-free. The last case of wild polio virus goes back even further to 1993. Meanwhile, we get about 150 cases of diphtheria every year. The Health Department now says that cases have not spiked enough to declare an outbreak. But on Thursday, it did confirm that a 10-year-old student in Manila died of the bacterial infection. Measles, on the other hand, was virtually gone from the Philippines from 2005 to 2009. So when it did return, some doctors found themselves dealing with a virus that was unfamiliar. Now the Philippines has the highest incidence of measles across Asia and second worldwide. Measles has killed 500 people and infected around 35,000 others in just the first 5 months of 2019. Now compare this to the 20,000 cases on record for the whole of 2018. So why are these diseases resurging now? Well, vaccination rates have been falling across the board over the past decade. In 2008, children had a 92% immunization rate against measles. Last year, this dropped to 67%. The same thing happened with DTP vaccines, which protect against diphtheria and tetanus, as well as polio vaccines, which save the kids from nerve injury leading to paralysis or even death. We have seen vaccination rates fall by nearly a third in a span of 10 years. And just as we were closing in on the national target of 95% immunization in 2008. But here's the thing, access to vaccines is not even supposed to be an issue. We have a presidential decree from 1976 and a law from 2011 requiring public hospitals and health centers to administer them completely free of charge. But the WHO says we have run into a logistics problem, meaning the national plan to distribute vaccines is not up to the task. Add to that some LGUs have been unable to manage health centers properly. This leads to poor facilities, which leads to wasted vaccines due to poor refrigeration. There is also something that they call vaccine hesitancy. That's when people refuse to immunize their children even if it is for free. This is not a new problem, mind you, but the Dengvaxia controversy did kick this issue into high gear. The London School of Hygiene and Tropical Medicine saw this in a study last year. The study found that in 2015, public belief in the importance of vaccine was at a high of 93%. According to their latest tally, this has since nosedived to 32%. Those who believe that vaccines are safe has also nosedived from 82% in 2015 to 21% in 2018, and that in just a span of 3 years. That is why the DOH is ramping up efforts not just to supply vaccines, but to inform people that yes, vaccines, if given in the right way, are safe, they are free, and most of all, they are very important. Dr. Rabindra Abayasinghe says the vaccine, the doctor is the country representative of the WHO, says that the vaccine-acquired polio virus is not unique to the Philippines, as the organization has already recorded similar cases in other countries. In a forum, the WHO representative also clarified that the country is still polio-free, explaining that what the Department of Health is fighting right now is a vaccine-acquired strain. The DOH already acquired the vaccine from the organization to combat this type of polio virus.
What WHO means when a country is polio-free is it means it's free of the wild polio virus. There's 3 types of wild polio virus. Your last polio case attributed to wild polio virus was in 1993, and you were certified as polio-free in 2000.